Economics of Healthcare Delivery, Nursing 474. Your weekly objectives include discuss issues specifically related to healthcare financing and economics, define levels of prevention as they are related to public health nursing, describe why it is important for the public health nurse to include a cultural assessment of the community, describe the functions of key governmental and quasi-governmental agencies that affect public health systems and nursing both in the United States and globally, perform a comprehensive community assessment of your selected community, collaborate with your preceptor and healthcare team, and review data collected from the windshield survey and the comprehensive community health assessment to identify health or environmental problems within the community. Public health and economics. Economics is the science concerned with the use of resources, including the production, distribution, and consumption of goods and services. Economics provides the means to evaluate society's attainment of its wants and needs in relation to limited resources. Health economics is concerned with how scarce resources affect the healthcare industry. Public health economics focuses on production, distribution, and consumption of goods and services related to public health and where limited resources might be best spent to save lives or cause the most increase in quality of life. Public health financing often causes conflict because the views and priorities of individuals and groups in society may differ with those of the public health experts, causing funding distribution challenges for a limited pool of resources. Public health financing is a growing field of science and practice that involves the acquiring, managing, and using of monies to improve the health of populations through disease prevention and health promotion strategies. Today, the public health system is much broader, includes schools, industries, environmental protection agencies, voluntary organizations, civic groups, local police and fire departments, religious organizations, industry business, and private sector healthcare systems, including the insurance industry. As far as economics, there's supply and demand. Microeconomic theory deals with the behavior of individuals and organizations and the effect of those behaviors on prices, costs, and the allocation and distribution of resources. Efficiency refers to producing maximum output, which is good or services, using a set of resources or inputs in such a way that there is no better way to produce the output and no other improvements to be made. Thus, it depends on both tasks and processes. Effectiveness, on the other hand, refers to the extent healthcare services meets its stated goal or objective and how well it achieves that intent. Factors affecting resource allocation in healthcare. The distribution of healthcare is affected largely by the way in which healthcare is financed in the United States. Socioeconomic status affects the ability to purchase health insurance or pay directly out of pocket. The effects of barriers to healthcare access and the effects of healthcare rationing on the distribution of healthcare are the uninsured. However, the Affordable Care Act of 2010 seeks to provide quality, affordable healthcare for all Americans. It defines a role for public programs. It improves the quality and efficiency of healthcare. It prevents chronic disease and improves public health. It addresses issues for the healthcare workforce of the future. It increases transparency and program integrity. It improves access to innovative medical technology, and it provides community living assistance services and supports and addresses revenue provision. That is what the Affordable Care Act hopes to provide. The poor is another problem. Socioeconomic status is inversely related to mortality and morbidity for almost every disease. Access to care remains a huge public health issue. The primary barriers to access to healthcare are inability to afford healthcare, lack of approval, coverage, or payment for care by the insurer, pre-existing conditions, and physicians' refusal to accept insurance plans. Rationing healthcare in any form implies reduced access to healthcare and potential decreases in acceptable quality of services offered. Therefore, it is a major public health issue. An example of rationing is a healthcare provider's refusal to accept Medicare or Medicaid clients. Both rationing and access are major public health problems. Where care is not provided, the public health system and nurses must ensure that essential clinical services are available. There's four major factors that affect health. They are personal behavior or lifestyle, environmental factors such as physical, social, and economic environments, human biology, and the healthcare system. Of these, medical services are said to have the least effect, and behavior and lifestyle have the greatest effect. Yet in 2009, 97% of the healthcare dollar is spent on secondary and tertiary care, resulting in high cost, high technology, and disease-specific care. A shift to primary prevention could result in significant reduction in the staffing needs and profitability of the healthcare system, the largest employer in the United States. Newer models of financing healthcare services, such as capitation, have attempted to shift the focus to preventative health services. Trends in healthcare spending and distribution of United States healthcare expenditures from 2007. Past spending reflects past decision making. Likewise, past decisions reflect the value and beliefs held by society and policymakers that undergird policy making at any given time. The Centers for Medicare and Medicaid Services project that the national health expenditures will reach $4.5 trillion in 2019. Per person healthcare spending was $143 in 1960 and $8,100 in 2009. The largest portion of healthcare spending is for hospital care and physician services. Only a small fraction of total healthcare dollars was spent on home health, public health, research, and construction in 2007, and this trend has continued. Factors influencing healthcare costs. Inflation, changes in population demographics, and technology and intensity of services are frequently cited as having caused the increases in total and per capita healthcare spending over the past 40 years. Demographics affecting healthcare data indicates that increases in healthcare expenditures have been influenced by population changes, such as increases in the elderly population and special illness populations serviced through publicly funded programs. As far as technology, the introduction of new technology enhances the delivery of care, but also has a potential to increase the cost of care. As far as chronic illness, this is a new factor showing its impact on healthcare spending. It accounted for 70% of total healthcare spending in 2007. Financing healthcare. Healthcare financing has evolved from a system supported primarily by consumers to a system financed by third-party payers. Combined state and federal government payments are currently higher than those of private payers. So as far as public support, the federal government first became involved in healthcare financing of the population segment in 1798. Today, the federal government pays a major portion of the nation's healthcare bill. As far as private support, private healthcare payer sources include insurance, employers, managed care, and individuals. Employers. Since the beginning of Blue Cross and Blue Shield, health insurance has been tied to employment and the business sector. Since that time, employers have played the major role in determining health insurance benefits. Before the growth of insurance, the healthcare consumer had more influence over healthcare costs because payment was out of pocket. With the growth of employer-based health insurance, employers played the major role in determining health insurance benefits designs. With the economic turndown in 2008, employers began to reduce their health insurance benefits or return the cost of insurance premiums to the employees. The increased portion of premiums being paid by the individual reflects of the shift of the healthcare cost burden from employers to employees as the percentage of employer contribution to healthcare declines. This makes consumers more knowledgeable about and sensitive to the price of health services and more likely to consider costs in making decisions to access types of healthcare services. Healthcare payment systems have positive and negative incentives. Several methods have been used by public and private sources to pay healthcare providers for healthcare services, including prospective and retrospective reimbursement for paying healthcare organizations and fee-for-service and capitation for paying healthcare practitioners. Retrospective reimbursement for paying healthcare organization is the traditional reimbursement method. Fees for delivery of healthcare services in an organization are set after the services are delivered based on cost or charges. Prospective reimbursement is a more recent method of paying an organization. The third-party payer establishes the amount that it will pay for the delivery of a particular service before offering the services to the client. Fee-for-service, the traditional method of paying healthcare practitioners, is known as fee-for-service, which is like retrospective payment method for healthcare organizations. This is specific for paying healthcare practitioners. The method is based on usual, customary, and reasonable charges for the specific physician services in a given geographic area. Reimbursement for nursing services. Since 1998, nurses who function in specialized roles or as primary care providers, such as nurse practitioners, clinical nurse specialists, and nurse midwives, are also able to receive reimbursement for their services, but at a lower rate than the physician rates. Nurses must plan for the future by developing an awareness of the cost of nursing services, by looking for opportunities to safely achieve cost savings, by acquiring knowledge on how nursing practice affects and is affected by the principles of economics. Nurses also must provide community-oriented nursing leadership, and nurses will contribute to improved decision-making about allocating scarce healthcare resources and thereby promoting primary prevention as an answer to improving many of the current population health outcomes.